and welcome to Medical Dialogues. I'm Dr. Bhumika. Let's look at today's top medical news. Need to remove existing barriers for effective weight loss. Expanding access to new, highly effective weight loss medications could prevent more than 40,000 deaths a year in the United States, according to a new study led by researchers at Yale School of Public Health and the University of Florida. The findings highlight the critical need to remove existing barriers that are hindering people's access to effective weight loss treatments and impeding public health efforts to address the national obesity crisis, the researchers said. Medications like glucagon-like peptide-1 receptor agonists such as Ozempic and dual gastric inhibitory polypeptide and GLP-1 receptor agonists such as tirzepatide have shown promise in clinical trials and are increasingly being used for weight management. A happy partner may help you manage stress, especially in old age. University of California study. Having happy, intimate partners might not only lift our moods, but it also helps us manage stress, especially as we age, according to new University of California Davis research. When comparing individuals' self-reported emotional states and relationship satisfaction with their level of cortisol, researchers observed that older couples have lower levels of the stress hormone when their partners feel positive emotions. This effect was even stronger for people who reported higher satisfaction in their relationships. The study was published in the journal Psychoneuroendocrinology. Having positive emotions with your relationship partner can act like a social resource, said Tomiko Yoneda, an assistant professor of psychology in the College of Letters and Science and the study's lead author. In old age, the links between our emotions and cortisol may be even stronger. Older adults also tend to have stronger psychological responses to stress, but their bodies are less able to slow down their cortisol production. For older couples, intimate relationships might play a role in managing their cortisol levels, researchers said. Can MRI predict patient outcomes and the risk of tumor recurrence in rectal cancer cases? Magnetic resonance imaging can spare many patients with rectal cancer from invasive surgery that can carry lifelong side effects, new research indicates. The findings from UVA Cancer Center's Arun Krishnaraj, MD, MPH and collaborators indicate that the MRI can predict patient outcomes and the risk of the tumor recurring or spreading for patients who have undergone chemotherapy and radiation. That information could be extremely useful in determining the best course of treatment and deciding whether a patient can avoid surgery in favor of a watch and wait approach, the researchers say. In watch and wait, doctors continue to monitor patients for cancer recurrence or spread, holding off on surgery but potentially leaving them uncertain and anxious about the future. The information MRI can provide would be both useful for doctors and comforting for patients, the new research finds. Rectal cancer is typically treated at first with radiation and chemotherapy, but some patients require what is known as total mesorectal excision, the removal of substantial portion of their bowel. This can be life-saving, but it can also be life-changing. Side effects can include the need for a permanent colostomy bag and sexual dysfunction. Schizophrenia linked to fourfold increase in sudden cardiac death risk. The lifetime risk of an unexpected and sudden death from a cardiovascular cause in the absence of pre-existing heart disease, known as sudden cardiac death, is more than 4 times higher for people with schizophrenia than it is for the general population, indicates Danish research published online in the journal Heart. The risk is still around twice as high for those with other types of mental illnesses, such as depression, whatever their age, indicates the findings, which suggest that an 18-year-old can expect to live around 10 years fewer than someone of the same age without mental health issues. The research to date indicates that young people with a psychiatric illness are at a heightened risk of sudden cardiac death, but it's not clear if that risk extends across the lifespan or if particular mental health disorders are associated with greater risk. To find out, the researchers systematically reviewed all deaths occurring in the 18 to 90-year-old Danish residents over the course of 2010, drawing on information from death certificates and post-mortem reports. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.